Did you know that 1 out of 3 ladies will have some sort of urinary incontinence at one time in their life? So if you're one of those ladies who suffer from urinary incontinence, or if you have any urge incontinence, if you feel like you need to find a washroom once you have the urge to, if you wake up in the middle of the night many times to use the washroom, if you start to use pads just in case anything happens, if you feel like you can't jump anymore, you can't go to the gym anymore because you will have leakage, if you already have leakage when you cough, when you laugh, let me tell you that you are not alone. There is a lot of ladies around there that are having the same exact symptoms you do. And we're here to help you. And I'm going to tell you how, through the years, I was able to help so many of my clients successfully to overcome their shyness and to overcome their fears of wearing diapers all the time and smelling like pee and having all of this rotation down below, how I was able to help them to even regain their confidence during their intimate relationship with their partner, because this is definitely one of the things that can be affected. My name is Dr. Marina Pshay, and I am a certified family physician in Ontario, Canada, and I'm also a certified OSHA provider. I am also a certified OSHA trainer who has been training other physicians and nurses on how to do these procedures so they can also help their own clients and help more ladies to feel their best. Let me talk to you about why we have the incontinence to begin with. So basically, over the years, we started to lose our muscle tone, just like we lose the muscle tone everywhere else in our body, like in our arms and in our legs. If you're not somebody who's going to the gym all the time and you're not trying to build your muscles all the time, then you will definitely start to lose it over the years. And when we started to lose the muscle, you can see a lot of changes because the muscles can be replaced with fat cells. You can also see the sagginess and the creepiness in the skin, and this can affect basically anywhere in your body. When we talk about the pelvic floor muscles in particular, it's even much easier for us ladies to lose even at a younger age because of all of the pressure that happens with the childbearing. If you have ever been pregnant before, if you have having this pressure all through the time, if you have been having baby for 9 months, if you go through the delivery process, all of these factors that's in addition to the hormonal factors and the aging factors definitely can affect the strength of our bladder, and it can affect the strength of our pelvic floor muscles. So most of these factors are something that's out of our control. We can't really correct it, and we cannot control these factors anyway. So what can we do now in order to go back in time and go back to where we used to be before? This is why we're having this interesting discussion with you. So if we know the problem now and we know where the problem is happening, the first step we need to do is, of course, we need to work on strengthening the muscles, because once we're able to strengthen the muscle down below and strengthen your pelvic floor muscle, we will be able to support your bladder back to where it used to, because your bladder now is dropping and dropping because there is nothing that is supporting anymore. So the first step we need to do is we need to work on strengthening your muscles. Strengthening your muscle can happen through physiotherapy, Kegel exercise. Those are all great ways to strengthen your muscles. But we all know that if you're trying to build your muscles in your arms, for example, you need to be exercising at least 5 or 6 days a week. You need to be going to the gym. You need to be doing weights. You need to take it really seriously in order for you to build the muscles. So same thing when it comes to physiotherapy and when it comes to Kegel exercise. Physiotherapy and Kegel exercise are phenomenal ideas, but they cannot be enough on their own, because they can help you to strengthen your muscles a little bit, which will actually help to postpone the progression of the situation getting worse. But to correct the actual problem that you already have now, it needs to take its time and it will take so long. And you need to be exercising and doing those Kegel exercise and going to the physio for almost every day, which is a very hard thing to be done during our busy schedule. So those are definitely something that you need to continue on, but what else can be done in addition to that? So we have other ways to go right into your vaginal wall to stimulate the muscles, not just into the vaginal wall, but also to the muscles around it. So we have the laser treatment, which is the Fotona non-invasive laser treatment. This laser treatment is a great way to not just stimulate your collagen in the area, but it's also great to tighten and to lift your muscle. Same thing when we use laser for the face, it helps to tighten and lift. So we do the same thing for your pelvic floor muscles and to the vaginal wall. So you will definitely notice the tightening, the lifting, and that will not just happen to your vaginal wall. The laser beams will go to everywhere around it, and that will help the whole muscles to be remodeled again. And you can definitely notice a major difference, not just in the urinary symptoms, but also in the size of your vaginal wall. So it helps to tighten the vaginal wall. Not only you will notice the difference, but your partner will definitely notice the difference too. It will help with the lubrication if you have any vaginal dryness. It will help with the itching, and it will also help with the repeated UTIs that you might be having, because repeated UTI is a sign that you have bladder prolapse. Another treatment that I would like to talk about is the O-shot. O-shot simply is PRP injection that goes right into your vaginal wall, and PRP stands for platelets-rich plasma. PRP is drawn from your own blood, so we basically draw the blood from you, spin it in the centrifuge on a very high speed, and when it spins in the centrifuge, that will split the red blood cells from the plasma. The plasma is the product that float on the top. It has your platelets, growth factors, all of the good nutrients in your blood, and this is the part that we will take and then re-inject you in your vaginal wall. O-shot will be injected after, of course, everything is being done for quite some time, so the procedure tolerance is very well. Very unlikely that will be any pain during the procedure. And this injection will go right into your vaginal wall. This is a great way to help with the vaginal dryness, and it's also great to help to stimulate the blood supply. It also works for the nerve ending, so it helps a lot with the sensation, the pleasure that comes with having a relationship, and it also helps with the satisfaction and the orgasm. So O-shot stands basically for orgasm shot. It helps you to go back to those days when you were having this so much enjoyment with your partner. Another idea that we also have is the vaginal radiofrequency. Vaginal radiofrequency is another way to help with tightening, lifting, and stimulating the muscles in your vaginal wall and all around your pelvic floor muscles in general. Radiofrequency is a very effective way that's known in aesthetic medicine to improve the tightening and lifting. Same thing when we do radiofrequency for the face, you can actually see your lining going away and disappearing by stimulating a lot of collagen in the face and stimulating the circulation and stimulating the blood supply. Same thing can happen to the vaginal wall. This procedure is minimally invasive since we have to go with the radiofrequency probe inside the vaginal wall, same as the laser, but you have to stay tuned here because everything will be numb and the procedure will be comfortable. How long it takes for me to see the results? It depends on which procedure we do. If we're talking about laser and radiofrequency, it usually takes about few weeks for you to start seeing the results, maybe 2 to 4 weeks. This is how long it will take for your body to start producing the collagen, and this is when you started to see the results. O-shot will be around the same time frame, maybe 4 weeks for the O-shot to start to actually noticing any difference in terms of the dryness and the sensation. And of course, your results will continue to get better as your body is producing more collagen. So we usually say the process of collagen production takes between 4 to 12 weeks, which means if you're having your procedure today, you will start to see some results at the 4 weeks mark, but these results will continue to improve. So this is not your final results. Your results will continue to improve up until 3 months from the day you had your last procedure. So out of these treatments, which one should I choose? That's a good question I get asked all the time. And the answer is I should not really rely on you to choose which one is perfect for you because you didn't go to medical school to learn about these procedures. This is why I always prefer to do a very thorough consultation. During the consultation, we will do pelvic exam and we will assess where we're at now, and we will also talk about the goals and which part is the part that bothers you, whether it's the vaginal dryness, whether it's the lack of sensation, or whether it's the urinary incontinence, or whether it's all in one. So it depends on your concerns. I will definitely be able to help you to choose which treatment will suit your needs the best. I will also be able to help you to choose how many sessions you will generally need and how long we should space them apart. Generally speaking, in an average client, we usually talk about 3 to 4 sessions that would be spaced 3 to 4 weeks apart, simply because with one session, you will definitely be able to see some results, but we cannot correct everything that has been happening over 40 plus years with one session. We definitely need to continue to rebuild the collagen and continue to boost your results. At what age I should start these treatments? Ideally, this is the same thing if you ask me, when should I start to go to the gym to maintain my muscle mass? The earlier the better, simply because when you wait till your muscle mass is completely wasted, when you're 75 years old, you start going to the gym, do not expect your arm will look exactly the same way it would look if you start to go to the gym earlier. So the rule of thumb is when we work on our muscle fibers, the more muscle fibers we work on, the better results will be. So my advice to you is if you ever have any starting of the symptoms, that's a sign for you that you need to start with something. If you don't want to wait, even if you can keep up with the symptoms, if you can use pads to cover the leakage, that doesn't mean that you are able to correct the problem. Don't wait too long before you try to correct the problem, because the longer you wait, the more muscle fibers you're losing. And by the time you show up to us here, the amount of muscle fibers you will be so much less than if you showed up when you first started having these symptoms. So my recommendation is, even if you're not sure, come for a consultation, let's have a discussion, let's do an assessment, and then at the end of the assessment, I will be able to give you my professional recommendation. Non-surgical labiaplasty is another thing that can be added to these procedures, or it can be done at all. Non-surgical labiaplasty can be done by improving how everything looks from the outside, and this is for cosmetic purposes. This is a great way to look better and to look younger in terms of filling your labia, in particular the labia majora. There is many ways to do that. It can be done through PRP. It can also be done through the laser. It can also be done through other injections that can be discussed based on what you're looking for. In general, whether you're getting the non-surgical labiaplasty or you're not, we can show you before and after before we even proceed with the procedure. The before and after will show you the huge difference we can actually see even from how things looks from the outside. It will show you how much tightening and lifting can happen just in 20-25 minutes. We have before and after pictures that we're not going to be able to show them here, but we have them all at the clinic and we can definitely share them with you when you show up for a procedure. So if you or somebody that you know of will benefit from these procedures, or even if you're not sure, if you want to just talk about it, always feel free to reach out to us. I will be more than happy to help you through your journey, and I'm sure that I will be able to make you so comfortable during the procedure. You can always reach out to us at 705-712-3737.